This is Dr. Kenneth Lewis. This video is for patients who have been scheduled for a selective nerve root block, and occasionally that can be referred to as a transforaminal epidural steroid injection. Both of them treat a similar area on the spine. That procedure is typically performed only in the lumbar spine and in the sacrum in my office. In the lumbar spine, what we're specifically interested in is finding out whether one or a number of specific nerve roots, spinal nerve roots leaving your spine, are irritated at the site where they leave the spine. They can be irritated by a bulging disc, as is described by this model, or they can be irritated inside the spinal canal by a bulging disc or by other abnormalities in the foramen, which is the hole where the nerve root needs to exit. Our goal is to try to place a solution on one or two roots specifically thought to be involved in your pain. This is the type of pain that is sometimes referred to as a sciatica or burning pain down your leg. It can be in the front, side, or back of your leg, and it can extend all the way from your low back down into specific toes or a number of toes. This may have been preceded with simple high-volume lumbar epidural steroid injections where the entire internal component of the epidural space around the spinal cord was treated. But if that was not successful or was not specific enough for the diagnosis, we may choose to bring you in to do what's called a selective nerve root block. On that day, an IV will be placed so we can have some light sedation, because the goal is to take a very small needle that is so small that it has a little bend on the end that allows us to steer the needle around corners. Once we've numbed the skin, we're going to guide that needle very carefully around the corner into the small bony opening where the nerve root exits. Now, during that procedure, I'll be watching the procedure on fluoroscopy, but nerve roots don't show up on x-ray, but we know that they're there, and so we go very slowly at that point in time. You'll have light sedation, but you'll be able to communicate with me because I'll be asking you to specifically tell me when you start to feel any type of discomfort or pressure in your leg. So for instance, if I was treating this root here, I would slowly guide that needle towards that little space, and as I slowly enter the actual foramen, the hole where the nerve root exits, you'll start to feel something either down the front or side or back of your leg. At that point in time, I stop immediately, and then I inject a small amount of contrast, which is a liquid that shows up on x-ray. As that medication leaves my needle, I can see it coat the nerve root, and for the first time now I can see the nerve root, and I specifically want to see it coat the nerve root, and I want to see it stay there. One of the other reasons for the contrast is I want to make sure that there's not a blood vessel near that injection site that's going to carry the medication away and make it useless. I want to also see that medication enter the foramen and go inside the canal if the goal is to do what's called a transforaminal or through the hole epidural steroid injection. If I want to treat just the root, I simply need to see the medication coat the nerve root, and that would be what's called a selective nerve root block. Now, for a selective nerve root block, we're then going to use a very small volume of local anesthetic and steroid and numb one root and then add a small amount of steroid. For the transforaminal, just like with any other epidural, once we've entered the foramen enough that we can see the contrast entering the epidural space, typically a slightly larger volume will be utilized because we're not specifically picking out one root, but simply trying to treat a general area around that root. So those are the procedures, or that's the process that you can anticipate if you've been scheduled for either a transforaminal epidural steroid injection or a selective nerve root block. This is one of the procedures that I strongly encourage that you have a driver and be prepared to have some light sedation, because sometimes there can be a momentary period of discomfort as we touch the nerve root. And I like to tell patients that this is not an error, it's not an accident during the procedure, it's actually the targeted goal of that procedure to be so close to that root that we stimulate it, but then we can also put the treatment medication, diagnostic medication, which is the local anesthetic, and the treatment solution, which is the steroid, directly on that root. This is a very common procedure in our office, something we've done many thousands of times, and if your pain is a pain that extends either through an arm or down a leg and presents as a nerve root type of pain, this is very likely a procedure that you will be scheduled for. Thank you.